Sawasdee Krap, and good afternoon once again. Today is Saturday, the 17th of April, 2021, here at the CCSA. So, firstly, thank you to Dr. Tuisin once again for the briefing that we heard just now in Thai, and I'll recap that in this summary of mine here. So, first of all, greetings to all the audience that we have. The audiences have been following our briefings for many months. If some of you have been following since last year, you would see that our content is designed to be updated all the time. Sometimes in the past, we did not have any graphics. This time around, we have graphics, we have more information, more charts, and more things to illustrate the situation to you, as well as important data as well. So just talking about illustration, Dr. Tuisin just now ended with some information, some pictures, which I'll show you tomorrow perhaps on the various field hospitals that Thailand has set up in many provinces around the country. But first off, I'll first talk about a recap from yesterday. As you can see, we'll be having some graphics for you on screen. The CCSA has agreed to recategorize the COVID zoning areas for various provinces. 18 categorized as maximum controlled area. You can see that in red on screen. And the remaining 59 provinces in controlled areas, which is in orange on screen. So this totals the country's 77 provinces, 76 plus Bangkok. And I'd like to take this opportunity to elaborate also on the control measures that will be effective starting from tomorrow for a minimum of 2 weeks. So this is a recap of what was summarized and agreed yesterday, and it has been published in the Royal Gazette already. Being published in the Royal Gazette means that the various measures are official and to be implemented. So just a recap of these new measures. Firstly, no curfew, as authorities have decided against a curfew because of the concern on the impact of the livelihood of people, especially at the grassroots level. However, the CCSA urged people to minimize and reduce travel and reduce movement between 2300 hours to 0400 hours, so 11 p.m. to 4 a.m. in the effort to reduce social gatherings, which hopefully will successfully help us to curb the spread of the virus. And we have encouraged all public and private agencies to also allow their employees to work from home at the maximum capacity to minimize the risk of infection in the workplace, and also advising against unnecessary inter-provincial travel for the time being. So in terms of the nationwide measures, I'll just recap what was discussed and agreed yesterday. The measures include, firstly, the closure of entertainment venues such as karaoke places, pubs, bars, and parlors. Second, alcohol consumption will be prohibited in all restaurants. Third, any social gathering of more than 50 people will be prohibited unless having been approved by the provincial CDC. Fourthly, all schools and educational institutions will be closed with exception to some international schools which have to conduct placement examinations, which will be considered on a case-by-case basis for those exams. And of course, online learning is the mode of teaching during this period. Fifth, indoor amusement parks, game arcades, and indoor playgrounds will be suspended, closed. The shopping malls will be closed at 2100 hours or 9 p.m., and the number of visitors must be limited. In addition, promotional events will not be allowed. 6, all banquets and gatherings must be canceled or postponed. In the maximum controlled area, or red zones in particular, there are additional specific measures. First, number 1, dining at restaurants is allowed until 2100 hours or 9 p.m., and takeaway service is available until 2300 hours or 11 p.m. Convenience stores, supermarkets, flea markets, and walking streets must be closed from 2300 to 0400. So this is number 2. Number 3, fitness clubs Exercise venues and sports arenas and fields will be closed at 2100 hours. Sports competitions are permitted with limited number of spectators. Now, for the controlled areas, controlled zones, or the orange zones, additional measures are as follows. Number one, dining and takeaway services at restaurants are allowed until 2300 hours. Consumption of alcohol beverages is not allowed. Second, the same rules apply to shopping malls in red zones, apply in the orange zones. Number three, no restrictions at convenience stores, supermarkets, flea markets, walking streets, and sports venues and fitness clubs and centers. Now, all of the mentioned measures will be implemented from the 18th of April, 2021, which is tomorrow, Sunday, for a minimum of 2 weeks. And additionally, provincial authorities are also giving the mandate to impose disease-controlled measures in their own provinces as they deem necessary. And that's the authority of each particular province. So moving on to the general situation and number of cases that we have recorded for today. We have 1,547 cases reported for today. Out of that number, 228 cases are from active case finding. The active cases being treated currently, as you can see on the red box in the infographic on screen now, is 11,916. Now, the new recoveries and total recoveries we have now actually is far behind the number of cases that have been treated and new cases. I'm sorry, the recovery number is way behind the number of cases that are new cumulative cases. So you can see on screen there, 28,000 versus 40,000, making the active cases over 11,000 now. Unfortunately, we have 2 new fatalities to report for you today, making the cumulative number standing at 99. The first fatality is from the Thonglaw cluster, a 38-year-old programmer who visited Crystal Club in Bangkok's Thonglaw area, the entertainment venue, which has since been closed. The individual visited this area on the 19th of March and passed away in Tak province. On the 4th of April, he took the COVID test at the hospital after developing symptoms such as cough, sore throat, muscle pain, and tested positive eventually and hospitalized in the same afternoon. His symptoms improved when admitted to the hospital, but it deteriorated due to the high potassium levels in the blood, and he sadly died yesterday. He was also suffering from high blood pressure, diabetes, and obesity. The second case of fatality is a 51-year-old male with pre-existing conditions and passed away in Pathum Thani province. So our condolences to the 2 cases of fatalities. Just some observations from the cases. Around 1,300 plus cases were detected in hospitals and healthcare facilities. And of these cases, the majority, around 279 cases, were found in Bangkok. If you break it down into locality-based. And second is from Chiang Mai, the highest number from Chiang Mai, 140 from Chiang Mai, and 99 from Chonburi and the other provinces. Lastly, there are 3 cases today from overseas and who have been placed directly into the alternative state quarantine system. And as you can see, health authorities are continuing to find new cases of COVID in Bangkok and other parts of the country through various methods, including the active case finding. I also just want to draw your attention to an infographic coming up on screen, which shows the epidemic curve from the 1st to the 15th of April, 2021. Now, in the Thai version, there are many graphs and curves for you to see. We have one here for the English language version. This curve shows a steep increase from just 26 cases on the 1st of April up to 1,443 cases on the 15th of April. You see the bars there, the blue bars. This shows that this strain of virus is more easily transmitted than the previously detected one in Thailand, which resulted in the higher number of infected persons in such a short span of time. The current outbreak is mostly affecting young people who may have a few symptoms at all or any at all, making it more difficult to control. So it's important, of course, to note first that young people travel a lot and interact a lot with peers. It's important for everyone to apply the basic preventive measures to continue to give importance to this, including social distancing, washing hands, avoiding touching the eyes, face, nose, and mouth, and of course, wearing masks. Update on vaccination. The vaccination rollout in Thailand continues, and as of the 16th of April, yesterday, we have administered 605,259 doses, inoculations of vaccines, counting since the 28th of February, and this has been done in 77 provinces. The Public Health Minister has reaffirmed that AstraZeneca vaccine will be the cornerstone for Thailand's vaccination program, and the ministry will start the jab rollout of this batch this June, and setting the target to have 50% of the population inoculated by the end of the year. For the time being, the Prime Minister has reiterated that vaccines can be procured through government-to-government deals only, and hence it is impossible for the government pharmaceutical organization to sell vaccines to private sector, and they must be distributed to private hospitals through the Association of Private Hospitals. On the program, the health officials have continued to inoculate people while relevant authorities are seeking to procure more vaccines from different sources, such as the United States and Russia, to achieve the target of having 60% of the population inoculated, ultimately 60%, to develop herd immunity. Now, on this, the Ministry of Foreign Affairs of Thailand is in the process of coordinating with Russian authorities in the effort to procure the Sputnik 5 vaccine in addition. The Prime Minister has also urged retired medical personnel to volunteer to come out and help out in the vaccination campaign. So just to reiterate once again that the Ministry of Public Health strongly recommends that members of the public remain vigilant and remain steadfast in adhering to the important DMHTT measures and practices. And as you may have heard from widely reported news, there are more than 100 medical staff at many state hospitals who have been forced into self-quarantine, who have been required to be in self-quarantine after patients have failed to disclose facts of their timeline truthfully, or that they have been in contact with infected people. Now, these incidents added more burden and workload to the healthcare system. Obviously, and to keep healthcare workers safe and hospitals running, it is very, very important, and I stress very, very vital for everyone to reveal their travel history and possible contact history with infected persons to the medical staff when asked. And on an ending note, I'd like to show you some images, some photos of frontline workers who have been dedicating their time, themselves, and their work to fight against COVID in Thailand. And this is on screen. Dr. Tuisin also showed this. Frontline and other essential workers face long hours, heavy workloads, which can lead to fatigue, mental distress, and burnout. And these images are, of course, in Thailand. So let's continue to support our healthcare workers and thank them for their service. So the take-home soundbite today might be protect yourself, and also let's help protect our frontline workers so that they will be able to continue to do their job and help us rid Thailand of COVID once and for all in the near future. So thank you very much for your kind attention today. Please enjoy the rest of the weekend, and then we'll see you again tomorrow here at the CCSA. Thank you, and สวัสดีครับ